So, as always, we have a lot to talk about today. We're going to lead off with Trump doing something which I personally think is a good thing. And then we're going to talk about more about the House version of the budget bill or the budget proposal, the tax cuts, and all that. That just passed the House officially. And then we're going to talk about the Trump administration is floating the idea of requiring undocumented immigrants to get fingerprints or fingerprinted. So, a lot to say about that. Anyways, let's start with the recent executive order that Trump just signed. This is from Reuters, and it is Trump signs healthcare price transparency executive order. So, February 25th, yesterday, as of the time I'm recording this, U.S. President Donald Trump signed an executive order on Tuesday aiming to improve price transparency on healthcare costs by directing federal agencies to strictly enforce a 2019 order he signed during his first term. The order directs the Department of the Treasury, Labor, and Health and Human Services to, within 90 days, come up with a framework to enforce Trump's 2019 executive order forcing health insurers and hospitals to disclose healthcare cost details. So, in 90 days, come up with a concept of a plan, is what I'm reading here. Anyways, so this could end up just being kind of toothless, but it's at least, in spirit, a decent order. Let's continue reading about it. This includes requiring the disclosure of actual prices, not estimates, update existing guidance, or proposing new regulations that ensure price information is standardized, and updating or issuing enforcement policies that guarantee compliance. You're not allowed to even talk about it when you're going to a hospital or see a doctor, and this allows you to go out and talk about it, Trump told reporters as he signed the order. It's been unpopular in some circles because people make less money, but it's great for the patient. Trump's initial 2019 order required hospitals to maintain a consumer-friendly display of pricing information for up to 300 shoppable services and machine-readable file with negotiated rates for every single service a hospital provides. It requires health plans to post the negotiated rates with providers, their out-of-network payments to providers, and the actual prices they or their pharmacy benefit manager pay for prescription drugs, and to maintain a consumer-facing internet tool making price information accessible. It was strongly opposed by hospital groups who unsuccessfully challenged it in court. They argue it forces them to disclose private negotiations with insurers, undermining competition and violating their First Amendment free speech rights. Oh, please. Okay, so this is a good thing, and it's such a democratic move too. Like, this is something like I'm surprised Joe Biden hasn't done. Like a little tweak around the edge of like the giant issue that is healthcare in our country. Yes, this is a good thing. Transparency. You should know how much you're gonna pay, what you're paying for, etc. I don't buy the nonsense of it's undermining First Amendment rights or making price negotiations harder. That should all be transparent to the consumer. They're already making a lot of profit off of our healthcare, which is just insane to me. So, you know what? I don't care what they have to say, to be honest with you. So, this is a good executive order, but this shouldn't need to be done in the first place, okay? We we live in a country where the number one cause for bankruptcy are medical bills. It's significantly higher. The Kaiser Family Foundation showed that 41% of U.S. citizens carry some sort of medical debt, and 24% were considering bankruptcy to solve the medical issue. So that's crazy. We we should not, in the wealthiest country in the world, we should not have people going into debt of any sort for healthcare unless it is strictly elective. If they're getting plastic surgery or something like that, then yeah, I have no problem with making them pay for that. But for anything for your actual health and well-being, critical, whatever, that should be fully government subsidized. This is not some crazy pie in the sky idea. This is something that is adopted in every other developed nation in the world. And a lot of people say, well, they have long wait times. Like, we don't. Like, am I the only one that sat in the ER for like 18 plus hours just to be seen? And you don't even get a room anymore, at least in the hospitals near me, because they're either so booked or that's just not a thing anymore unless you're literally dying. So, yeah, this is a good executive order. I appreciate it. It's an improvement of the system we're stuck with. But what I really want and what I really wish for is to solve the problem, and that is government subsidized healthcare, a single payer system, or some combination of the sort. We are the only developed country that does not guarantee healthcare to our citizens. We should not have people dying every year because they don't have access to healthcare. We shouldn't have people afraid to go to the doctor because they can't afford the cost. So they end up having an issue that if they would have got it checked out sooner, it could have been treatable. But they waited until it was past the point of treatment because they were afraid of the cost. And that just shouldn't be a thing here. I know I'm kind of really getting off, but healthcare is a very important issue to me. And I just will anything but guaranteeing healthcare to every American for free. That's any other conversation is a non-starter because there's no reason we shouldn't. And studies have shown that we actually spend more on healthcare than any other nation per capita or GDP or whatever. And we have worse outcomes. And we still don't guarantee free healthcare. That's crazy. That's because you have a middleman, insurance companies, making billions and billions, hundreds of billions in profit off of your healthcare, off of denying claims every year. That's their whole profit motive, is seeing how many claims they can get out of paying. So, yeah, I'm still off topic. Can't help it. Important issue. Anyways, let me know what you think in the comment section down below, and I will see you in the next one. If you made it to this point in the video, I just want to give a special thank you. If you enjoyed it, please hit that like button down below. And if you really enjoyed it, maybe consider hitting that subscribe button while you're down there. I want to hear your thoughts in the comment section. I will try to reply to any and all comments that I can. Until next time, watch that video on screen.